I think of USDS as an amazing recruiting pipeline for our agency. Our former CIO was USDS. We've now hired multiple former USDS into high-level positions. And I've sat on hiring panels at CMS, and I know everyone thinks that like people are just dying to get into these high-level government roles, but they're not.
Today on the Daily Scoop podcast from the Scoop News Group, how CMS is approaching AI adoption. Part 2 of my interview with digital service at CMS lead, Andrea Fletcher. It's Tuesday, October 29th, 2024. Welcome to the Daily Scoop podcast, where you'll hear the latest news and trends facing government leaders. I'm the host of the Daily Scoop podcast, Billy Mitchell. Thanks so much for joining me. Today, we're back with the second part of my interview with Andrea Fletcher, the head of digital service at the Centers for Medicare and Medicaid Services. Last week, in the first part of our interview, we discussed the history of the team, how it got its start, and the types of thorny problems it's trying to solve for. And now in part 2, we dive into how the healthcare agency is thinking about AI adoption, the biggest challenges the digital service at CMS team faces, and what's ahead. With that said, let's dive right into part 2 of my interview with Andrea Fletcher. And I'm glad you mentioned the open source, work that you're doing, because it sounds like that's something that's really timely right now and that you're really, pushing headfirst into. So I wanted to ask, what some of the bigger themes or items that your team is focused on today. That sounds like one, but if you want to go in depth on that, and if there are others as well, that'd be great.
Yeah, our team love the open source program office that we've been building. We built the first one in the U.S. federal government. It's a common thing at places like the UN, the WHO has one. We're seeing other countries have them as well. And it's basically a way for us to both inbound and outbound code. So a lot of software is built off of open source packages. It's very common to download something off the internet and put it in your code, right? Yeah. And in some of our early conversations with CISA around the cybersecurity of that, like knowing what is in our code, knowing what is in our source code, is a way to be more proactive, be a more proactive cybersecurity posture, right? Yep. So, knowing what we're inbounding, knowing what's in it, knowing who's in it, being able to fix vulnerabilities faster. We launched a new vulnerability disclosure program with CISA. We're in kind of a pilot phase within the last couple of months. And then we also launched we have a new policy around that. We have a new open source policy where basically CMS is saying we want to use open source software, and we're going to do this in a safe and secure way. And here's our plan for doing that. And then we also outbound a lot of code. And this was going on at CMS well before I got here. I got here in about 2021. And we have already had some massive APIs. We have some of the largest bulk FHIR, FHIR, which is a healthcare interoperability standard. We have the largest bulk FHIR APIs, I think, in the world, like Blue Button 2.0 and data at the point of care. This is opening up Medicare beneficiary data. And those are open source. We have some other really big projects. We use a lot of Drupal for our websites, but how do we basically start to make a best-in-class team of promoting open source at the agency, supporting teams that are putting software out there? A lot of health IT, and I didn't realize this until I started kind of moving around the domestic side of health IT more. A lot of it is built to be in compliance with CMS, right? Quality of care data. We saw a bunch of this with hospital price transparency, where if CMS can put a free template out there or a free tool that other people can adapt and use in their code, it makes everything a lot cheaper, a lot faster, better. They're automatically in compliance. Here's the CMS tool, right? If you use this thing, you're good to go. Particularly for smaller providers, I think that's a big win, being able to just take a template from CMS and go with it. And the best way to do that is often in an open source repository on GitHub. And so how do we make sure that we have processes in place to actually open that software up? And that's what the OSPO is doing. We have a team of software engineers who go around supporting different parts of CMS on releasing their software. And then having metrics around all of that, having scanning around all of that to make sure that we're releasing secure software that we're monitoring it, that we have teams in place who can respond if somebody has a bug, right? Mm-hmm. Or a vulnerability, that we're capable of actually managing that source code.
And just as a follow-up, I mean, it's not lost on me that open source is a major thing, especially in the digital services community. But what about it makes it such a good fit for CMS and the healthcare community?
It's such a large space. Healthcare is 20% of the US GDP. And we have everything from, Fortune 500 companies in there to providers who are, the only person in their organization, right? Or small local clinics and free clinics and hospitals and things like that. And so it's just this wide swath that we have to serve with different technical capabilities. And I think open source is a way for us to be fair about that and provide services to everyone. And also to drive the cost of some of this down and drive the resources that it takes to actually implement these tools. Because you might have it might be a huge company with large software teams, and they get excited when we release this stuff just as much as the smaller teams that don't have, many hospitals don't have a CTO or a like the IT person is also the nurse, right? And so making sure that those organizations are also able to get the same benefits out of CMS.
Yeah, that totally makes sense. I'm curious, you mentioned your dual-headed role sort of as overseeing this team and being that leadership liaison advocate for technology. What about how you interface with the main USDS team? Obviously, CMS Digital Services sort of I don't know if it's correct to call it an offshoot or how a sub unit.
We're an agency team. We're not really quite sure what that means 100%.
Yeah. But how does that relationship sort of continue to work now that, the team is away from the core USDS team? I see you're wearing a USDS sweatshirt right now.
So I'm going today. Usually, often I'll have a CMS one. I go back and forth. So we have a relationship with USDS. We have like an MOU and some things like that, an agreement. And so right now we get about 10 staff from USDS. So we constantly are keeping a flow of engineers coming in, particularly, but also designers and product managers to support projects at CMS. I think of USDS as an amazing recruiting pipeline for our agency. Our former CIO was USDS. We've now hired multiple former USDS into high-level positions. And I've sat on hiring panels at CMS, and I know everyone thinks that like people are just dying to get into these high-level government roles, but they're not. Like there are positions, technical positions, where we don't get qualified applicants. And so really making sure that USDS staff know what CMS is and get a chance to try the agency out a little bit. And sometimes people come in and they're like, I didn't know I loved Medicare payment systems so much. And you're like, great. How about you apply to these positions over here? Because I think from an outsider, like if you look at how big and vast the government is, and even an agency like CMS, where you've got multiple parts of the organization where you could land and you have no idea what they do unless you're really in there. So our relationship with USDS is often as a partner on projects. They'll bring stuff to us that, somebody at the White House thinks this is important. And we're like, okay, like let's go see what's going on. Sometimes we'll take stuff to them and say, hey, we have a problem here. We think we need some extra hands, or we need to work across a couple of agencies and it's really hard to coordinate. Can you help out? But then also just they send us some staff and we have a pretty steady flow of, I'm former USDS, my deputy director's former USDS. It's a lot of people when they're in their USDS tour will land at CMS and decide to stay.
Yeah.
And I think that's a huge benefit to the agency. And it takes a really long time to hire people. It's about 9 months to hire a career service employee in the federal government. So having people sitting on a tour of service, trying things out, filling in, it also helps the agency decide, do we need that role? Do we need that? We hired a zero trust advisor, right? Elizabeth is former USDS who came in through our team. And the decision was made, hey, we actually really need somebody to run zero trust for the agency. And we were able to give great candidates, right? And that's key, I think, as we try to figure out some of these new technology and emerging technologies that we have to implement. Like, what skill sets do we really need, and can we try them out before we go, spend 9 months trying to hire someone?
Yeah, no, that's very cool. And it's a great way to think about that sort of, I don't want to call it a backdoor relationship, but it creates that backdoor pipeline of talent, as you mentioned, where you don't have to recruit obviously that's still going on, but there's an ability to pull people who have experience in these spaces in and sort of swap them in at CMS.
Yeah, and we recruit from the health tech sector, but I think in Silicon Valley, if you go say to people like CMS, they don't know what that acronym is. They think, content management system or something else, right? And so USDS has a brand name in technology that we're able to kind of leverage in that sense. We have a brand name in healthcare, which is different, right? And so we're able to kind of get different pockets of talent.
Yeah, very cool. You mentioned the emerging technology stuff, and we touched on it a bit in sort of the opening of the conversation. But when we first met, it was at this GDIT event. You were talking about generative AI. You had a great PowerPoint that, as I mentioned, had a lot of people laughing at this sort of absurdity and sort of I guess just the reality of where generative AI is today. But I would love to talk and sort of extend that conversation a bit to hear what are some of the takeaways on how, whether it's you at CMS are looking into AI, or you just looking across the landscape of government and how government's adopting AI? What does that look like, and how is that exploration going?
Feels a little like a scramble right now, right? There's an executive order. I think I sit in a couple of different kind of lenses or views of this. I help co-lead a cross-cutting initiative for AI at CMS. And there's kind of three major parts of that. One is policy. We regulate entities that are using this technology, right? And they're using this technology to give people healthcare or deny people healthcare, right? And so what are the policy regulations that need to be in place? Making sure that if somebody denies you a procedure, that there's a human in the loop, right? Mm-hmm. And that you're not and then we're seeing the bot wars of billing. The billing bot wars have begun, right? And so there's a whole group of people who are just thinking about how do we regulate the healthcare sector and our slice of the healthcare sector. The FDA has already approved, I think it's over 1,000 AI algorithms, most of them in imaging, right? So there are some huge benefits to using different image recognition software for cancer screenings, for example, right? And so they're really in charge of that. We're in charge of health insurance, right? And our programs, and also quality of care, right? Fraud, waste, and abuse is a huge use case for AI. So there's a whole group of people looking at policy. There's a whole group of people looking at infrastructure and governance. So how are we using these tools internally? How are we governing their use of them as an organization that, does billions of dollars in contracting and has thousands of employees? And then I also sit, the group that I'm leading is around workforce. I'm sure you've heard this before. If you haven't heard it from me, that we have a retirement cliff heading our way for technologists. For every one under the age of 30, we have 4 over the age of 60. So we have to recruit in the next generation of talent. We have to think about a talent plan and strategy. We have to upskill our existing staff. We have to go through change management. And one thing, federal government staff love is change. These are people that love risk. So how are we going to deal with the disruption of what AI seems to be doing to other industries, which is staff, right? Our people, jobs are going to get automated away. Then what do we do? How are we reorganizing ourselves when that happens? How are we thinking about our workforce in a new way? So that's how CMS is thinking about it. One thing I think is pretty exciting and why we've been focused on open source is without open source, you don't get AI. All of the major, a lot of the major models are open. It's a foundational part of all of this. And when people ask me, how are you going to be transparent? And I was like, we have to build these things in the open. We have to be unafraid to be so transparent that we put our code out there and we let people know what we're actually doing and take the box off, like take the black box away. Because that's the biggest risk and issue that we've kind of heard coming up and over again is people use this black box analogy of like, there's a black box and I don't know what's in it. And how do I know what's in the box? And you're like, you just have to open it up. You have to open it up. And so that's, I think, where I see this heading for us. And I think a lot of other people are thinking the same thing, which is we have to do this in the open. And that is scary for a lot of people in government.
Yeah, no doubt. I mean, I don't want to oversimplify it, but I think at times industry doesn't make it easier too with their capitalistic, financial centric take on it. But we won't get into that conversation. I am curious, just you've mentioned a lot of things, workforce, some of the change management, things like that you have to deal with or the team has to deal with. But what would you consider, there's this major push across government to really implement and I guess, uplift digital experience. There's an executive order around it, but it's not without its challenges. And I'm curious what you see as some of the bigger challenges. Again, you've mentioned a few, but are there certain things, whether it's bureaucracy, funding, the workforce, that stand out as the biggest?
Yeah, I mean, the bureaucracy, the Paperwork Reduction Act of 1993, when I think about things that I wish every American were excited about, it is making changes to some of these government processes that haven't been changed in so long, that are the spirit of them is good. The intention is good. But the way that it plays out in a day-to-day bureaucracy, like navigating it, it's like getting stuck in the mud, right? And how do we need to update some of these laws. We need to update some of these regulations around how we're building software. Because it does make it harder for us to do usability research, for example. And I can't tell you the number of times I've gotten in a conversation about user research, which is something I used to do in sub-Saharan Africa. I used to take a phone out with a community health worker and, go on visits and actually use the app in real live sessions, right? And I get people say, okay, well, did you go through IRB for an academic research review? And I was like, no, that's not what we're doing here. Like, we just need to test the software, Well, how many participants have you had? And did you do a focus group? And it's an academic process because that's what people know, right? Yeah. We get told we need a mountain of paperwork that we have to fill out in order to talk to people. I'm like, these are just our citizens and we just need to talk to them because they're using our tools and we need to make sure that it's useful to them, that they understand the language. And then the clearest example I have of this recently too, when we get in fights with lawyers in particular, is the regulation for emergency department. It's emergency department. Well, nobody in any of our user research said department. They said room, right? You called an ER. I was like, I think I used the phrase, they didn't call the TV show emergency department. It wasn't ED, it was ER. Everyone knows if you say ER, people know what that is. Well, the legal regulatory language is department. And so how do you go back and forth? Our team is often, poor designers are often kind of in fights. It feels like with lawyers we understand that's what the law says, but that's not what the humans think. That's not what they say. And so, making sure that their perspective is heard, because otherwise you get websites or tools or, policy that doesn't make sense to a normal person.
Yeah.
Not in plain language. And so, I have a lot of thoughts on customer experience, but the hardest part of it all is just actually talking to people. Yeah. And we've put a bunch of rules and laws in place. So it makes it harder for staff to actually, federal employees, to just go talk to people who they serve, and ask them if this makes sense. I think that's the hardest part.
Yeah, no, that totally makes sense. And I think it's very analogous to what I hear from the Department of Defense or DHS, just trying to implement digital policy or digital services in a government that was created, and hasn't really changed much in decades or hundreds of years.
And part of our role is making sure that their voice is in there and making sure that, we had a team who they were supporting SAMHSA on 988, which is the national lifeline. And they stood out on the mall and asked people about, the hold music and whether or not it was annoying, right? But they literally just walked out onto the national mall and talked to people. And it's kind of fascinating when you see that happen, how it changes how it changes our relationship with the technology that we're building, right? Yeah. And a lot of what we end up doing is just saying like, no, you can do this. Here, we'll go do it. We'll bring you the results back. This is what the results are, right? And here's why we did this. Here's why this is important. Look at how much it improved the use of the technology, right?
So, I think we can kind of bring this all into a final closing question. I mean, that's obviously those challenges are super frustrating, but hopefully there's, a bright future ahead, and, some of these things are going to change and be updated in a way that, digital service teams like CMS's is going to be able to do things a lot more effectively and efficiently. So question is, what's ahead for CMSDS going forward? And, for those listening in who might want to be a part of that, an opportunity for you to, give your recruiting pitch or just share how people can be partners.
Always recruiting. Gosh, there's a lot ahead for us. I think in the last couple of years, we've really grown in the breadth of work that we have at CMS. We are supporting pretty much every major center and office at the agency. And we have people who are continuing to stay well beyond their tour of service. My pitch is actually to early career. I mean, I would have loved joining something like the open source program office at a young age. And particularly if you're a young engineer, I think often it's like, oh, you're not going to learn to code in government. And I think that's different when it comes to open source. I think that's a really great place where you can learn a lot early on in your career and support a larger ecosystem and have this huge impact well beyond, your lines of code that you write. And that's where we're looking to place a lot of our early career staff. So we've been working with the US Digital Corps. We've been working with Coding It Forward. We're also working with US Digital Service and Presidential Innovation Fellows. So there are tons of programs out there that are looking for awesome people to join them. And we support a lot of them. We have them coming in and into the digital service through those programs as well. But my pitch would be like, let's make open source happen in the federal government. And that's what I think we're the most excited about, because it can truly transform the way that these agencies work.
That's very cool. Andrea, fantastic conversation. It's been a pleasure to kind of just go from the beginning of CMS Digital Service and talk about what's ahead and everything in between. It sounds like the team is healthy and thriving and that things are going in a great direction. And I really appreciate everything you've shared with us today.
Thank you so much. Thank you for having me, Billy.
For more on AI adoption in the federal government, visit fedscoop.com. Thanks so much for tuning in to another episode of the Daily Scoop podcast, available on all podcast platforms. If you've already rated the podcast on your platform of choice, thanks so much. High ratings and good reviews of the show help more people to find it. The Daily Scoop podcast is a production of the Scoop News Group in Washington, D.C. Adam Butler and Carlin Fisher help put the show together, and the entire Scoop News Group team contributes. We'll be back tomorrow with more top headlines. Until then, I'm your host, Billy Mitchell. Thanks so much for listening.